What is the expected salary package of a postgraduate in ophthalmology?
Ophthalmologist joins as a consultant in corporate hospitals. The average salary package ranges from 1.5 lakhs to about 2.5 lakhs.
What are the hurdles and what is the initial expenditure that is required to start your own center?
So if you have to put up your own setup, it requires a big amount of money for putting up these machines. So initially you start with the basic equipments for an OPD, like a chair unit, an auto ref, a slit lamp.
Can you just briefly tell me a brief idea about the cost of those equipments you mentioned?
So the slit lamp would range from about 1.5 lakhs to 10 lakhs. An auto ref would cost you about 8 to 15 lakhs. A phaco machine can cost you about 10 lakhs from the basic minimum. A small glass piece, if it goes wrong in that machine, it costs you about 5 lakhs straight away.
How to do marketing for your own setup and your hospital?
In today's world, without marketing, you can't make your name. Marketing has become one key ingredient to becoming famous. So
Hi, I'm Dr. Rahul Chawla and welcome to episode 4 of NEET PG Mentoring Sessions podcast. And today I have Dr. Sukriti Gupta. She has done MD Ophthalmology from Safdarjung Hospital, New Delhi. And right now she is practicing as a consultant ophthalmologist in her own hospital in Faridabad. So Sukriti, can you please tell me a bit about your journey? What did you do after your MD ophthalmology and if you did any fellowship after that?
yeah, so I completed my undergrad and my postgrad from Safdarjung Hospital, New Delhi. And post that, I did my senior residency for 2 years again from Safdarjung Hospital. After that, I joined a private hospital. I worked there for 6 months. Post that, I did a 3-month observership, which was a sponsored fellowship from FICO, which I did in Royal Free Hospital, London. And post that, I started working with my father in our hospital, Bharti Eye Care Center, Faridabad.
Okay, great. So you are now Malkin of your own hospital, and I think that's a great feat. So Sukriti, why did you decide to take ophthalmology as a branch?
So my decision was based on a few requirements in my life. I did not want to have an emergency branch. I wanted to go into a surgical branch, and I wanted to have a work-life balance along with it. So the best option out of all the surgical branches that we have is ophthalmology, because it's a neat and clean surgical branch with no emergency and a good work-life balance. Hence, I opted for ophthalmology.
Yeah, actually, neat and clean is the perfect word to describe. I was just going to ask you, even ENT, Ophtha both are similar branches, but then you clarified it. You wanted a neat and clean branch.
ENT is an emergency branch also, no?
Yeah, actually, tracheostomy and all, plus foreign body. So, as we know, ophthalmology is a very cool branch, and also it offers a great work-life balance. So, it is often thought, that ophthalmology as a branch is suitable for girls.
More and more females are getting into surgical branch, and more girls are going into ophthalmology because of the few reasons that I said, that it gives you a surgical angle and yet you get a work life balance, unlike gynae obs where you need to do emergencies, your nights, you have night shifts and all. So there is nothing of that sort in ophthalmology in private sector. Till the time you are doing job in government setup, there will be emergency. You will be required to do night duties till senior residency. But after you get into private sector, there is no emergency as such. And also, though there is no sexism among doctors, but there is a hint of sexism from the patient's point of view, because till now even I experience patients not taking a female surgeon as seriously as they would take a male surgeon. There are good female surgeons who have made their name, so keeping them in mind, keep working towards it and keep trying to change people's perception.
Yeah, very true actually. So one of the reason why I started this series was that when we are, doing residency, when we are doing undergrad, PG, and even SRship, we sort of live in a cocoon, and we really do not have any idea what happens in the outside world. And that is true for each and every branch. No one has any idea, what salary they get in the corporate hospitals, how they have to jump up the ladder, and how to pursue different fellowships, and even when you have to start your own setup, there are so many things which a person has to know and nobody has any idea. So the first thing is, when you complete your MD in ophthalmology, is it necessary to undergo 3 years senior residency as well before joining a corporate hospital?
Not 3 years of residency is, but see, first of all, it depends from which college you are doing your post graduation, because in many hospitals they do not teach you phacoemulsification surgery, which is the basic surgery for cataract. But all the job offers that come up, they always have a description for 2 to 3 years of experience post graduation. So having a 2 to 3 years of senior residency experience is a must, I must say, not just to get into the job, but also to open your hand and having a feel of doing independent surgeries. Because once you are as a senior resident in a hospital, the onus of every case comes to you, and you have to see that patient from the beginning till the end. If a case goes wrong, you have to manage those cases.
And how difficult is it to get senior residency in tertiary care hospitals like Safdarjung, AIMS, and all the big hospitals in metro?
Again, the seats are in like a pyramid. The number of postgrads will be more, the number of seats for senior residency will reduce, the number of assistant professor seats will reduce, and obviously the HOD will be one. So it's a pyramid. Only the top few students are selected, and so it's not easy.
So you see, when we know that doing SRship is very essential, but the number of seats of SRship is less compared to PG. So again, it creates a very difficult scenario. So you might complete your MD from a good institute, but you might not get SRship in that institute.
It's not an easy game. The world out there is a competitive world, and even coming out from a big fame hospital like AIMS, people struggle to get into a job.
Okay. And how is the SRship in private hospitals?
So as a junior consultant, it becomes a hectic job there. And the pay is also not as much because you don't have the experience, and they are, according to them, they are doing a favor on you for having you without an experience. So it becomes difficult. It's better to do senior residency in a government hospital, especially because you're coming from a surgical branch. You need to have good hand in surgery before you join a private hospital. When I was selected for a corporate hospital which I joined, in my interview I had 2 days of interview. One was a theory interview, and the second day I was called in the hospital and made to operate on a Ayushman case, and then they saw my surgery and then they selected me.
Okay, and that is something that is really unheard of. So if someone decides to go for fellowship or super specialization in ophthalmology, so which are the subspecialties wherein you have MCH seats available at the moment, and which are different branches wherein you have 2 or 3 year fellowships available, which are really good and which can actually give a great kick to your career?
Yeah. So ophthalmology being an end branch is a myth now. PGI Chandigarh has started with MCH in vitreoretinal surgery. That's the only one right now. But there are many fellowships in multiple subspecialties like glaucoma, in medical retina, in cornea, in neuroopthal, and in pediatric ophthalmology, and also in comprehensive ophthalmology. So these are 4-5 branches which have fellowship. And as we discussed, without fellowship in future, things will get difficult for people to become famous and rich.
So all these fellowships are 1 year fellowship, 2 year fellowship, or 3 year fellowships?
So there are varieties of fellowships available. Usually the vitreoretinal surgery fellowship is a 2 to 3 year fellowship, and but But fellowships like cornea and refractive surgery, which is an emerging branch now, which includes LASIK surgery, it is usually from 6 months to 2 years. It varies.
Okay. And all these fellowships which you're talking about, which are short-term courses, are these paid?
So yeah, short-term fellowships, some hospitals like private hospitals offer short-term fellowships. There you need to pay them to get into those fellowships. But yes, there are some international fellowships for which you clear the exam and get through those exams, get into those fellowships. They are sponsored fellowships. So the one fellowship I went to was through fellowship of International Council of Ophthalmology, for which I had been giving exams during my post-graduation.
So what's the difference between somebody just doing plain ophthalmology versus somebody doing a fellowship of 3 to 6 months and somebody doing a super specialization or 2 to 3 years fellowship?
See, when you do a fellowship for 2 to 3 years, you are reducing your niche of patients. You are catering only to that niche of patients. In ophthalmology, cataract surgery will remain the bread and butter. Even if you are a VR surgeon, even if you are a squint specialist, even if you are a glaucoma surgeon, you will be earning only because of cataract. That will be your basic revenue. Over and top of that, you will be earning a name because of the speciality that you have done. That also only for the difficult patients that a comprehensive cataract surgeon is not able to cater to. So as a postgraduate and doing senior residency in a good hospital where you are exposed to all kinds of super speciality little bit, then you are able to handle all kind of patients to a level. But when it requires expert opinion, then you are referring your patients to those super specialists. So doing fellowship will never be a disadvantage, but not doing a fellowship is not also a disadvantage. Unlike in internal medicine, where maybe people are more driven into MCH and DM now.
So how does one see down the line 2 or 3 years after completing residency? What is the difference in the kind of pay package or salary they may expect as a beginner in corporate hospitals in all the three scenarios? Plain MD ophthalmology versus somebody having a short course of fellowship versus somebody having 2 or 3 year fellowship or super specialization.
So when a ophthalmologist joins as a consultant in corporate hospitals, the average salary package ranges from 1.5 lakhs to about 2.5 lakhs, depending on years of experience after your post graduation. So hence I said doing some years of senior residency will help you grab a better package. And then with fellowship, you obviously get better packages that may range from 2.75 lakhs to 3.5 lakhs, depending also on the city you are working in. Tier 2 and tier 3 cities tend to give you a higher package because less doctors would want to live in tier 2 and tier 3 cities. Hence the compensation is in terms of a higher package. And in 2 to 3 years or maybe 5 years, it grows exponentially because there is a component of incentives which makes a good amount in hand eventually.
So if you have to start your own private practice in ophthalmology, so what are the initial hurdles you have to face, and how much time and how much money exactly is required to start your own practice in an ophthalmology? Because it's a surgical skill and you have to have some equipments and your own OT, and I think that comes with a lot of cost. So what are the hurdles and what is the initial expenditure that is required to start your own center?
So the only disadvantage with ophthalmology as a branch is that it is a very machine based department. You are working, you are diagnosing, you are treating patients on the machines. So if you have to put up your own setup, it requires a big amount of money for putting up these machines. So initially you start with the basic equipments for an OPD, like a chair unit, an auto ref, a slit lamp. and a few diagnostic machines like OCT, and a very basic OT. But there also in OT, the cost of phaco machine and the cost of a microscope is hefty. Usually they have to take up a loan, but once your OPD starts running with the marketing that you do and with all the referrals with a doctor connect that you are able to bring out the revenue in about 2 to 3 years.
So I think that's a really lot struggle in terms of, the efforts you put in, and also not just the marketing and your own time, but it comes along with a lot of expenditure. So can you just briefly tell me a brief idea about the cost of those equipments you mentioned?
Yeah, so the slit lamp would range from about 1.5 lakhs to 10 lakhs, depending on the brand, the quality, and the optics you would want. And then an auto ref would cost you about 8 to 15 lakhs. Then an microscope would cost you about 20 to 25 lakhs. And a phaco machine can cost you about 10 lakhs from the basic minimum to about 80 lakhs, 90 lakhs, depending again on the company. So there is no limit to the quality of equipments that you can have, but I'm just talking about the minimal basic thing that is required. So it's a hefty amount. It's not a joke that, yes, I will put up my own clinic. You need proper funding, you need proper investment, and you need a proper plan how to execute it. And it's a step by step process. You can't build a hospital in one day.
It is often thought that if you have your own setup, then you will be earning a lot of money and you will soon become rich. But it is really difficult to, start your own setup, make it into a hospital, and then running that hospital is a complete different task altogether. So I think you can share some basic pearls about how to run the hospital and what goes behind, running and maintaining a hospital. What are the different hurdles you have to face while running your own setup as big as a hospital?
So, running a private hospital is not an easy job at all. So, apart from seeing the patients, you have to cater to multiple things in functioning of the hospital. You have to look into hiring your staff, their behavior towards their patients, the facilities that the patients get when they are waiting for you, and their appointment with you in the waiting lobby. We have to make tie-ups with multiple insurance companies so that the patients that come to our hospital have a smooth process towards their surgery. And also we have to cater to many losses that we conquer when there is some fault in our machines. The machine which is costing about 25 lakhs or 30 lakhs, a small glass piece, if it goes wrong in that machine, it costs you about 5 lakhs straight away. So that expenditure is not known to people on the other side of the hospital. Also, there have been instances when you have patients who do not pay you back. There have been instances when the insurance companies first give you an approval for the surgery, but later on, when the payment is supposed to come after a month's time, the payments are not coming. Then with the Ayushman Bharat program also, there is some lag in the money that comes to your hospital. The lag can be from 5 months to 6 months, but you can't deny the patient from operating. So there is a lag in the money rotation. It's not that you operate the patient and you get the money then and there. You have spent money in operating the patient, you have spent your consumables, you have used your consumables, and yet you have not got the money for those consumables even. So there is a credit lag there. And then also in today's world, there is nothing without marketing today. You have to, being a small clinic, you have to compete against the big giants that are now present, the funded hospitals that are coming up, and they are coming to just bite you, take you away, and make you a part of themselves. And you have to fight against them giving free consultations, is a very big scam, which we know, but patients don't realize.
It's quite a lot of hard work, quite a lot of expenditure, huge marketing, and it's really not easy to earn the kind of money which people believe the hospitals are making. So can you tell me something about, how to do marketing for your own setup and your hospital, both in terms of digital marketing and on-ground marketing, and what's the difference between the two? पुराने ज़माने में तो पेशेंट सिर्फ वर्ड ऑफ माउथ से आते थे, बट आज क्योंकि डिजिटल मीडिया का ज़माना है एंड बहुत सारे पेशेंट्स इंस्टाग्राम के थ्रू एंड गूगल बिजनेस के थ्रू आपके पास आ रहे हैं, तो किस तरीके से आप सोशल मीडिया को लेवरेजिंग करें, किस तरीके से वर्ड ऑफ माउथ से पब्लिसाइज करें अपने आप को, दैट ऑल्सो बिकम्स वेरी इंपॉर्टेंट. So what are your thoughts about that, and how do you go for marketing of your own hospital?
So in today's world, without marketing, you can't make your name. Marketing has become one key ingredient to becoming famous. So we are doing social media marketing as well as Google marketing, as well as on ground marketing. So the word of mouth spread of your name is still prevalent, especially in tier 2, tier 3 cities, because as a surgeon, your surgery skills show up. When a patient who's had cataract and is having good vision, it is evident to other people. So word of mouth will never die, but to reach to other cities, to increase your reach, you definitely need social media marketing. And also to stay prevalent, you need social media marketing and Google marketing as well. You have to make sure that your name keeps coming in their feed, so that whenever they would want to go to a doctor, your name will strike in their head. And Instagram does not give you any leads. YouTube might give you leads, but Instagram does not. It is just a way to stay prevalent.
So recently there was a company which launched their eye drops, and they claim that it can cure presbyopia, and patients might not even require reading glasses while reading. So what is the truth behind that claim, and does that really work?
To answer your question, the drug has been banned. The drug was a scam. It worked only for 4 to 6 hours, and you didn't need glasses just for 4 to 6 hours. But the side effect was that it was reducing the size of the pupil, making it look like a pinhole, which helped you read near subjects without glasses. But it used to give you a headache. So it was not what it claimed.
So it was a case of an inappropriate marketing of a product that doesn't give you the kind of benefit it has claimed. Thank you so much, Sukriti, for being part of this podcast. And you have shared very brilliant insights about ophthalmology as a branch, and managing your own setup and what goes behind running a private hospital. And I wish you the best for your future. I hope your hospital turns into a good, big corporate chain of hospitals, and you turn out to be a big entrepreneur as well.
Thank you, Dr. Rahul. It was a pleasure talking to you.